Suda and Dr. Ryan, and thanks Sages for giving me this opportunity to present. So to give a little background, I'm sure all of you know about the Da Vinci. It's a robotic surgical system made by Intuitive. Some of the advantages include 3D imaging, enhanced range of motion, enhanced dexterity. But the cost is really high, so it's worthwhile to do research on the efficacy of these new medical advancements. Past studies have compared robotic-assisted laparoscopy versus conventional laparoscopy, and have shown that RL is superior to CL in doing basic FLS tasks. And they showed that the robotic arms really gives a mechanical advantage over conventional laparoscopic instruments. No studies, however, have really assessed distraction as a factor and to see whether the immersive aspect of the Da Vinci contributes to the improved performance. A study by Wheelock and colleagues in 2015 showed that distraction plays a huge role and could impact performance in the OR. It showed that case-irrelevant conversations were associated with lower teamwork, and acoustic-related distractions were associated with higher mental workload. And this could ultimately lead to poor performance and higher stress, which can put the patient's care at risk. So to introduce our study, these are the questions we want to see. Does 3D vision help improve performance compared to 2D vision? Does the immersive aspect of the Da Vinci help block out distractions? Our hypothesis was that the immersive 3D optics helps block out distractions and contributes to improved performance. So in our study, we compared outcomes of laparoscopic skills by using just the 3D optics of the Da Vinci versus the conventional 2D monitor with and without distraction. As you can see in the picture on the right, it's one of our participants in the RL group. He is not using the robotic arms, however, because we want to assess distraction as a factor. So they don't have that mechanical advantage that past studies have shown. For our methods, we recruited 32 novices without any experience that were randomized into 4 groups: RL, RL plus distraction, CL, and CL plus distraction. Each participant performed 3 FLS tasks, increasing in difficulty 3 times each. First was the peg transfer, then circle cutting, and then suturing with knot. The distractions included visual distractions, people walking inside and out the door. Auditory, there was a script where our actors, they said certain things, and then certain music and like phone ringings were played. And then cognitive, where these actors would ask the questions to the participants. The same order of distractions was kept for each subject. As you can see, here are our 2 groups. So the people in the RL group, they use on the left, you see the robotic assisted laparoscopy, but they didn't use the robotic arm. So we had to create a platform so that they could use a conventional FLS box. And on the right is the conventional 2D monitor where the people in the CL group performed. So for our statistics, we calculated time, which was the time to complete the task. And then we took the mean of each trial, of all the trials. And for accuracy, for peg transfer, we measured the number of times the peg was dropped. And for circle cutting, biggest deviation from the circle in centimeters. And suture with knot, biggest deviation from target in millimeters. We used IBM SPSS version 24. And we did a one-way multivariate analysis variance, or ANOVA test, with Tukey's post-hoc test analysis for multiple comparisons. And a p-value of less than or equal to 0.05 was considered significant. So here's our results for time. As you can see, here, this table on the right just shows the mean of time to complete the task for each group and each task. And this p-value was calculated by the ANOVA test, which pretty much calculates whether there's statistically significant differences among the groups. So for each of the tasks, there was statistically significant differences. If you see in the graph, CL plus D in particular, they took much longer than the other groups to perform and finish the task. So here it shows the trials of a particular task in task 1. Above you see the post hoc multiple comparison analysis, which states is there significant differences between specific groups. So if you see, there's only significant differences when a group is compared to CL plus D, which is the conventional laparoscopic group with distraction. And the same thing for task 2, same thing was shown. So here's the CL group with distraction and CL group with distraction for time. And here's our second measure, accuracy. So as you can see, here's a table with the mean deviation or drops in accuracy. And for task 1, there was no significant differences, p-value of 0.5. However, for tasks 2 and 3, there were significant differences. Interestingly, for accuracy, when the RL groups were compared with each other, there was no significant differences, whereas when the CL groups were compared with each other, there also wasn't significant differences. So it was, in terms of accuracy, it mattered whether you're in the RL group, the robotic assisted laparoscopy, or the CL group. And here for task 3, same thing, no significant differences in RL and no significant differences in CL. So to summarize, once again, for time, the CL plus D group, they performed worse. They took much longer, as the task got more difficult. And this shows that, the immersive 3D optics really helps block out distractions, whereas the conventional 2D monitor doesn't. In terms of accuracy, the RL groups had shorter mean deviations than the CL groups for the more difficult tasks like task 2 and task 3, which require more precision and depth perception, showing that there are advantages to using the immersive 3D optics even when the robotic arms are removed. And the immersive aspect of the robotic console, this may help improve performance in the OR. This may allow the surgeon to be more focused at the task in hand, and this might clinically translate to better outcomes for both the surgeon and the patient. Here's our disclosure slide, and I'll take any questions.
It's an interesting study and nice study.
Yeah.
Any questions from the audience? I want to ask a question.
Yeah.
How did you do distraction? Is it standard for all groups?
Yeah, so we did keep a standardized distraction. Like I said, there was visual, so there were people walking inside and outdoor during a specific trial. That's the first one we started with. Secondly, there was the auditory, so we had a certain song play at a certain trial time. We also had a certain script where there were 2 people talking in the background. And then there was also cognitive, where we would ask the participants simple questions that were unrelated to the task.
Yes, please.
Yeah, Andres Barrera from Connecticut. I have a question regarding to the time. That was kind of the data that showed the most difference. Do you happen to have any outlier that moved the difference at such a high level of magnitude?
Oh yeah, thank you for your question. I think, so we did calculate the standard deviation of everything, and that was included in our manuscript. So for each of the tasks and each of the results, it was normally distributed. So while there were, both ends, deviations, it wasn't significant. So.